Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. Welcome to episode 274.
Yes, I'm excited. We're talking about, it's not a topic that I can relate to, but I guess it's in line with some of the discussions we've been having recently around regenerative health and things like hormones, and obviously menopause is an extension of that. So we're here to talk about that today. But before we get into that, any news, Jake, you want to talk about before we actually, we're 2 days away from heading to Thailand. So this is one of the last podcasts we're recording before we off.
Yeah, well, hopefully we had a good time. It's now October 18th, which, by the way, is World Menopause Day.
Yes.
So we should shout out to all the women, and hopefully if you're going through symptoms like this, then this podcast will help you a little bit. And then, of course, we encourage you to see your doctor or someone who can help support you with those symptoms. But today is a sponsored podcast.
Yes.
We're with Dermocosmetica again. So George Kypreos, who was, I think it was 179, George, you joined us on episode 179, way back when we were talking about remodeling for the first time, but welcome back to you.
Thank you.
And we also welcome our special guest, Dr. Simone Bamford from Melbourne. So guys, do you want to introduce yourself first? And I'll start with George, just because the product that we're going to talk about today is from your company. So tell everyone about Dermocosmetica and what you do.
Yes, of course. Well, thank you for having me again. So I'm the founder and managing director of Dermocosmetica. We're a distributor of medical-grade cosmeceuticals, including peels and topicals, and also injectable treatments, as you know, from our bioremodeling. But one of the most exciting technologies that's come through since 2019 is this technology called MEP, which is really making some amazing changes to women's skin, and also helping with some of the symptoms and side effects of menopause.
Fantastic. And how long have you been running Dermocosmetica? Where are you based? And how would people get in touch with you if they wanted to?
Yeah, I looked at a statistic the other day. It was we've been in operation 4,759 days today.
How many seconds?
So that's 13 years of I guess sharing our knowledge, our expertise, and also our products to over 2,200 clinics across Australia and New Zealand, and obviously imparting our knowledge with a lot of the providers, the people that are working with the products, etc. So we've culminated with some good experience.
Absolutely. Fantastic. And obviously your details will be at the bottom of our podcast if people want to reach out. Now, Simone, would you like to tell our listeners about yourself, your background? I had a little read and your clinic looks beautiful, but tell everyone about your background and how you got into this crazy game of aesthetics.
Sure. I've actually been doing aesthetics since the early 2000s. My current clinic is Bayside Medical Aesthetics in Melbourne, which we opened in 2017. But early on, I've sort of had a bit of a 3 stages to my career. Initially thought I was going to do obstetrics and gynae, pivoted from that because of circumstances and general practice, and then just knew I wouldn't be able to do general practice straight up for the next 30 years. So I started looking at other things and got into the early days of injectables back in the day when we were all just had no idea what we were doing. Sort of around 2001, I actually went and worked for pharmaceutical industry. So I worked for Servier and CSL doing clinical trials, and worked on some of the phase 3 trials and phase 1 trials with CSL. All the while I was doing a bit of injecting on the side at night times, weekends, things like that. When I had my first child, sort of set up from home in 2008, as we did back then. And when I had my second child, I thought, that's it. I'm too busy with the injectables. I'm going to leave pharmaceutical industry, leave general practice. I was still doing a session here and there, and focus on cosmetic full time. And so, so that's been really since 2010 full time, and then I opened the larger clinic in 2017.
Excellent. Okay, so let's maybe get on to the topic of today, which is menopause and the effect it has on women's skin. But before we jump into the skin side of things, can you just, Simone, talk to us about what menopause is? I think most people, particularly women, know what it is. To the men listening, maybe we're all a little bit ignorant. So if you could just take us on a bit of a journey on what is menopause, when does it normally occur, and what sort of changes sort of impact the female body, and how does that sort of affect their physiology, the way they present to the world, and just give us a bit of an understanding before we jump into the skin.
Sure. Well, menopause itself is actually just a date in time. It's actually just the day that's 12 months since your last period. So really you talk about the phases. So you've got perimenopause leading up to that, and then postmenopause leading after that for the rest of your life. Women notice around the menopause that they notice the symptoms, but what's happening internally is that the estrogen levels are dropping because the ovaries are stopping producing the estrogen that they have been producing up until then. And they see a sudden drop in the estrogen levels. And it manifests itself really in women noticing a range of symptoms. Some people, none at all. Some people are really thrown around by it. Things from fatigue to brain fog to, changes in their skin to hot flushes, achy joints, a general feeling of just unease, insomnia. I mean, there's actually a list of around 70 symptoms that have been attributed to menopause. And in general practice, it's actually quite confusing, and you're not taught much about it at university. And when I was in my 20s in general practice land, people would come in with a range of symptoms, and you'd be sending them off to physicians left, right, and centre. And it ended up that it was just menopause, but it was menopause. It was the symptoms were all explained by menopause, and I think it's been poorly understood until now. And it's great to see that there's much more research going into it and much more information available.
Right, and so you said estrogen was the main hormone that sort of impacted, but we've got sort of three hormones, don't we? We've got the testosterone, we've got progesterone, and we've got estrogen. So is it just estrogen that's affected, or is there stuff going on with the other hormones as well?
Look, there are things going on with the others, but the estrogen is the main factor, and the estrogen is what has the main impact on a female's aging process, particularly on the skin. The estrogen levels drop 30% in that first 5 years after menopause, and 2.1%, per year after that. So that's the main thing. The progesterone and testosterone really, it's inconsequential, really, when you're thinking about what happens with the estrogen and the side effects that we see.
Excellent.
Can I ask Simone? I try and talk about menopause a little bit with my patients because, of course, many of them are in their 40s and 50s and they're noticing their face is changing, as well as all the other things that you just mentioned. And it seems to be something that women themselves don't fully understand. It's a bit of a taboo for some reason still. Is that a cultural thing? Is that an educational thing? Why is it sort of a secret almost for some women to talk about and sort of get help?
Yeah, look, I think I guess there's an element of people being embarrassed to say that they're starting to get to that point in their life. Up until now, I do think there's a shift. 80% of women are going to experience symptoms of menopause. And certainly in my experience, around 5% of women actually know that they can, that their menopause changes happen in their skin. And a lot of women still do not understand that they can get help for these symptoms. I mean, traditionally people have known, I'm getting hot flushes. I need to think about HRT. And then, there was a big shift away from that in 2002 when the Women's Health Initiative results came out and incorrectly reported that there was an increase in cardiovascular events. So I think there's been a history of women being led away from, seeking help for their menopause symptoms. I definitely think, certainly my patients, that women do not understand that menopause affects the skin. They don't put two and two together. They come in and they just say, "Oh, my skin's terrible at the moment. It's really dry. It's really, this," and then I say to them, "Well, where are you at with your periods?" And they think I'm going crazy, asking them about that. And luckily, I know my patients well enough that we can have that conversation. But they just don't associate the two, and I think that's education, really.
Yeah, I have to say sometimes when I bring up exactly that. How are your periods? How's your sleep and all that kind of stuff? They think I'm sort of prying for reasons that aren't related to their aesthetic. And so you sort of have to qualify, well, your hormones are changing probably from what you've told me. So that's going to change everything. So how does that change the skin and the face and facial aging? Because, that's how we're involved. We're an aesthetic podcast. And yet this is sort of a bigger issue. But obviously this podcast is going to focus on skin. So what do women see or complain of, when these changes happen?
Well, mostly I would say they come in and complain about dry skin and increased sensitivity of their skin. Most of my patients have been using cosmeceuticals. They're used to using, X, Y, Z. And then all of a sudden they come in and say, I can't tolerate it anymore. It's stinging when I put it on. I don't know what's happened. My skin's gone all dry. It's all of a sudden, and people who aren't necessarily using products for, anti-aging cosmeceuticals already, they're just saying, I feel like my skin's really dull. It's feeling, it's got more wrinkles, feels really just, they look in the mirror and they're just not happy with what they're seeing. So I guess they're the main things. Blotchiness, a bit of irritation. Estrogen is a very strong anti-inflammatory in the body. So that, there's flares of rosacea, sometimes acne reappears in that age group. Yeah, it's a myriad of symptoms, but generally dryness and just looking really dull.
Right. Okay. And so obviously we're here to talk about a specific skincare product that helps deal with that. But obviously we can take hormones sort of internally as well. So you referenced HRT. So what would be the primary sort of difference between what you can expect from sort of doing traditional HRT versus the skincare treatment, or would you use both of them together? Just sort of, I guess, to understand when you'd use what, or is it a case of using both?
Well, if my patients come in and, we've sort of put two and two together and said, okay, I think these are menopause-related symptoms, I generally will refer them off to their own, GP to talk about the estrogen loss that's happening with menopause, because I know that it's going to give them overall benefits. Mm-hmm. Yes, if they then end up deciding between their practitioner and themselves that they want to go on estrogen therapy for their preventative needs or for hot flushes or whatever, that's great. There is some evidence that it improves the skin, and I'm sure that, overall they're going to feel better anyway, because they're going to be sleeping better, so they'll look better. They'll just feel better in themselves. But there is a case that, often women also need topical products to enhance that, which includes estrogen enhancement for the face. We know that a lot of women on HRT also need vaginal estrogen because they still have symptoms from estrogen loss in the vagina, dryness and things like that. So it makes sense that they may also need that in the face. So then I speak to them about, okay, what are your options for increasing your estrogen levels in the face and all the benefits that will come with? And I do talk to them about the possibility of using hormonal estrogen, so estriol or estradiol on their face. There are creams that are used vaginally. They could get them compounded if that's what their GP wants to give them. But in the last few years, since 2019, we've had this great product which has been an alternative. It's a non-hormonal estrogen in a cosmeceutical form, and it's meant that we've been able to then say, okay, we now have this tool that you don't have to go and get a prescription for. We can give it to you. It's non-hormonal. For those people that are not keen on taking hormones, we can start to introduce that into their regime.
Mm-hmm. So would it be right to summarize, because like you said, I wasn't taught about this at medical school, and I graduated 2007. It's not that long ago, but is it right to say if you have systemic symptoms like flushes and mood and all the other things, that might be a conversation to have certainly with the GP about your overall systemic symptoms and hormone status, etc. Whereas if you've got, local symptoms like wrinkles, but you're generally feeling well, then you wouldn't necessarily need to see the doctor for HRT. Is that essentially what you're saying?
Absolutely. Yeah, absolutely.
Okay.
You can certainly just focus on the skin itself. There is a place for HRT for preventative health as well, for bones and cardiovascular. And so, as I say, that's something for the patient's practitioner aside from the aesthetics consult.
Okay. And do GPs actually do blood tests, or is it just a chat about the symptoms and putting two and two together that your mid-40s probably is perimenopausal? Let's trial a low dose of something systemic.
These days, you don't need a blood test to diagnose menopause. It does come down to symptoms. Sometimes practitioners will do a testosterone level check because some of the symptoms may be attributed to low testosterone levels, fatigue, loss of libido, things like that. And so that might be worth checking, but a lot of the time, GPs don't need to do a blood test to diagnose menopause.
Right. Okay. Let's talk about the product. I'm going to go over to you, George, because you're the head honcho over there at Dermocosmetica. So tell us about the product, what it is, where it comes from, who makes it, all the good stuff.
Thank you. Yes, the product is called Emepelle, and the ingredient is methyl estradiol propanoate.
It's a mouthful.
It's a mouthful, that's for sure. It's an ingredient technology that has been recognized by many skin specialists around the world, and in particular, Dr. Zoe Dralos, who references this ingredient in many of her articles in the US. It's a development of 15 years in the making from Yale University, and they were working in conjunction with our partner, our supplier in the US, Biopel, which is a subsidiary of Ferndale Laboratories, a pharmaceutical company that's been operating for, I think, nearly 130 years. So they are a small company in Detroit, Michigan that treats its skincare like pharmaceuticals, and they commissioned, not only did they get this unique ingredient technology from Yale University, but they've gone on further to actually validate its effects, of course, with the claims that Simone was talking about. And a number of different scientific studies have been performed, published in independent journals by a number of eminent dermatologists, in particular in the US. So it's called Emepelle. It's a nice small range that consists of a day serum, a night cream, and also an eye cream. But I guess you'll probably ask some more questions. But I think what's really interesting about this ingredient is that it really focuses on improving some of those symptoms and side effects that Simone was talking about. And this was proven in the original study with Dr. Zoe Dralos. But then they went on and said, well, what else can we add into this formulation to make it even better and more worthwhile, particularly with women that are experiencing some of these symptoms, like, the dryness, the increased sensitivity, the wrinkles, the sudden collagen loss. And so the manufacturer, Biopel, has, in addition to the MEP, added ingredients like niacinamide at higher levels, vitamin C, retinol, peptides, tripeptides, etc., to really help manage all those symptoms that affect skin during this menopausal phase.
Right. Okay. And how does this differ from, I guess, other products on the marketplace that I guess have been attempting to do similar things?
Yeah. So I as I mentioned here, we've got a technology that really targets estrogen deficiency. This is specifically made for this group of patients that are going through this period of their life. And it's a very, very simple solution. But I think Simone is probably a better person to answer that question medically.
Perfect. Well, do you want to add to that, Simone, in terms of, I guess, because I'm sure there are other products on the market, but I guess I really want to understand how this product is unique and different, and really get practitioners out there to understand why this is such a compelling product that they might want to talk to their patients about.
Sure. There are other products on the market that certainly retinoic acid we use a lot. We use vitamin C, but there is nothing else unless you use a prescription, estradiol or estriol, that actually activates these estrogen receptors. So the MEP technology works on the estrogen receptors in the skin, but it is non-hormonal. So once it goes into the skin, it's inactivated and there's nothing of consequence into the bloodstream. So there's nothing else on the market that I know of that actually can stimulate that estrogen receptor that is not a prescription estrogen. So the benefits of activating those estrogen receptors, you're going to get increase in collagen, elastin, which you'll notice the thickening up of the skin. What a lot of my patients notice is their skin feels more hydrated, and it just looks better in the mirror when they look. And the other thing is that it improves the barrier function of the skin. So that's, as I was saying before, a lot of patients come and they're not able to tolerate their usual retinols, their vitamin C's. They're just becoming irritated by it. So this product tends to improve that barrier, improve the hydration of the skin. But the beauty of it is, and this is again what a lot of patients love, is that it is so simple. There is a serum in the morning, a cream at night, and it includes everything that we would have otherwise prescribed. Everybody basically, as far as I'm concerned, should be on a retinol or a retinoic acid, a vitamin C in the morning, and Emepelle also has ferulic acid, which we love for repair of UV radiation damage, and also the hyaluronic acid for its moisture building properties. And a lot of my patients travel a lot, and they love the ease of one serum, one cream, fits in their sort of makeup bag beautifully. And apart from SPF, which is obviously non-negotiable in the mornings after the serum, they're good to go. And they really like the texture of it. It soaks in really nicely, and just does what it says on the bottle.
Excellent.
How long does it take to start seeing results? Because, many of our patients are either in love with skincare, but they're buying all the wrong stuff with nothing potent in it, and they're buying it from duty free and whatever their best friend uses. Or it's very hard to convert people to skincare, and they lean on toxins, fillers, and bioremodeling and other things because they want that quick fix. So how long does it take? And what do you sort of explain to your patients when you're starting them on Emepelle?
I find that it actually starts to work fairly quickly, particularly in the younger age group, sort of the 45 to 55. They're going to see results within 6 to 8 weeks. My patients, I know that the trials definitely showed that the younger the patient, the earlier they're going to see results. But within 20 weeks, even in the older age group in the trials, they certainly found a significant difference in the skin. So I try and start my patients on it earlier, but I certainly, for example, my mum is on it and she's in her 70s and she's been on it for a couple of years now and loves it. Yes, might have taken a bit longer for her to see the full results, but she continues with that and really enjoys the benefits of it. Obviously, I'm talking to my patients at the same time about building collagen using many other avenues. So we recommend radiofrequency microneedling, maybe Profilo, which is one of the newer products that also came out which is hyaluronic acid injected. So I find patients can include Emepelle into their daily routine quite easily. We generally say to our patients, just finish off what you're using if you are tolerating it. And then maybe just introduce the night cream to start with, because that has the retinol in it. And then they start enjoying the night cream. They finish off what they're using during the day and then say, right, what can I use now? Fine, use the serum. And they generally are quite open to switching over once they see the results.
Right. Okay, so let's get into the MEP technology a little bit for all the science nerds out there. So can you explain to us how it actually mimics the estrogen on the skin and sort of and sort of any other key ingredients that are in there that help do this?
Well, the compound itself, I guess George would know better about it, but the methoestradiol propanoate, it basically acts like it's an estrogen-like factor, and it binds to the beta receptor, the beta estrogen receptor, and acts like estrogen really. So stimulating collagen and elastin. It's working on the fibroblasts in the dermis. It's working on the keratinocytes in the epidermis to affect all these changes.
Right. And are there any sort of contraindications to the product at all that people should be aware of?
patients who've had estrogen receptor positive breast cancers, there's no evidence, as far as I'm aware, that there's been any trials in that patient group or any other hormone-related cancers. I have a few patients who've had breast cancer, and one in particular that's been estrogen positive. We have discussed it, and she needed something for her skin, and we decided to use it with her, and we monitor. She obviously has monitoring regularly, but that's a discussion to have with the practitioner. And otherwise, it would only be if someone's not tolerating retinol, for example, at that point in time. I would say, right, just come off everything. We use a lot of particular emollient or humectant product that will just build their barrier. Maybe do that for a month, 6 weeks, and then start to reintroduce something like Emepelle into this program, so that their retinol can just be eased in and not aggravate the skin anymore. But no, as far as I'm aware, look, there's not anyone that really is contraindicated.
Excellent.
You mentioned there's vitamin C, niacinamide, and then in the night cream you've got retinol. So for the injectors out there who know nothing about skincare, why are those actives so important? What do they actually do, and how are they sort of complementing the Emepelle and the MEP technology?
So the retinol itself is stimulating the collagen production in the skin. It increases cell turnover, so you get a lot of the blotchiness of the skin is less because you're moving the melanin through from the base and sloughing it off. The vitamin C is a great antioxidant, and the ferulic acid, fantastic antioxidant. So all of these things work in combination along with the hyaluronic acid, which is drawing moisture and giving you some of that hydration. Yeah, so they're all working together really with the peptides, as George mentioned.
Yeah, that's a good question, actually. Peptides, you're a fan of peptide technology,
yes.
but maybe in a different form.
Yeah.
But what do they actually do? Because, there's people out there talking about exosomes and PRP and all these other things to sort of stimulate cell growth and sort of regenerative medicine. So what do the peptides actually do, and how do they differ from, some of those other things?
Well, my understanding is that the peptides are able to penetrate, and they're used as part of the building blocks for creating collagen. As far as the scientific nature of that goes, I'm not exactly au fait with that, but I know they are certainly very powerful in all the studies that I've read at helping produce collagen, which is in essence the building blocks, and it helps with the extracellular matrix of the skin.
Fair enough. Now, you mentioned that you might combine this with bioremodeling or radiofrequency needling or other treatments. I mean, it seems that every treatment builds collagen and elastin. We sort of say it, whether it's biostimulators, bioremodelers, even HA, there's some evidence that it stimulates the fibroblasts. So can you quantify it? Can you say which one is best, or which protocol, do you choose for your patients, or is there a particular patient for a particular regime?
Look, I don't know if you can actually quantify it. I do know from just going to, all the conferences internationally over the years, it seems that radiofrequency microneedling is the gold standard globally in terms of deep stimulation of that collagen. But from a cosmeceutical point of view, the Emepelle is the closest I've seen to getting something that's the most effective. Apart from retinoic acid, tretinoin, a lot of people love their tretinoin, particularly in my clinic. And they sometimes that question does come up, what about my tretinoin? Can I use that with the Emepelle? And I certainly say that they can, because they can, if they're tolerating it and they've got a good skin barrier, then absolutely they could use their Emepelle night cream and then use some tretinoin over the top. I'd certainly encourage them to do it very slowly and do it, maybe 2 or 3 times a week on a certain part of their skin, just to see that they are able to tolerate it. But in terms of collagen building, I generally say to my patients, just do something every few months that's going to cause your body to create some sort of wound repair process, which is going to create the collagen.
Yeah.
So whether it be Profilo, whether it be needling, even ultraformer, ultrasound technology for tightening of the skin, where there is a 2 millimeter ability to target the skin. And so that is creating heat and creating a wound repair process, creating collagen.
Yeah, it's like going to the gym for your face.
Absolutely.
Yeah, I do think that there's some patients out there looking for the one treatment or the magic cream. And it's like, well, no, you got to do everything.
It's no silver bullet.
It's a consistency issue rather than a particular product.
Yeah.
But of course, you know, if you're not using Emepelle and you're going through a menopause, might make sense to actually get some MEP technology in you.
Yeah. So what's your actual protocol, Simone, for when you sort of get patients started on this, and sort of do you have different protocols for different categories of patients? So you mentioned different age groups potentially might take longer to see the full benefit, and then people that are already using retinol, you might sort of get them to stagger it in different ways. So can you just run us through sort of your basic protocols for maybe your most common different types of patients that you might get through?
Sure. It depends where they're at in their menopause skin process, because if a patient comes to me that with very irritated skin, you know, rosacea flare, and they just can't tolerate anything, as I mentioned before, we just take them off everything. And we just say, right, use something very simple, very basic, something that's going to really hydrate their skin twice a day and wash out everything. They've often been using, you know, when patients start to have trouble with their skin, their go-to is, well, I'm going to run to Mecca, I'm going to run to Sephora and try and get the girls there to help me get me something that's going to fix my skin. And then they start using all these different actives and it only gets worse. So we just say to them, look, put everything to the side. Don't necessarily throw it out, but just put it to the side and just use something very basic for 4 to 6 weeks and just wash out the skin and build that barrier up. So that sort of patient, I will you build their skin barrier and then maybe introduce the serum, maybe not the cream to start with if we're nervous about them flaring up, but the serum, it doesn't have a retinol, but it does have all of the good things that we want to repair the skin barrier even further. And they can use that morning and night if they want to start with. Then at the other end of the spectrum, we've got patients who are fine, but they're just noticing their skin's not glowing as well. They're not happy with their current products. In that case, I'll just say to them, finish up what you're using, start with the night cream. If they've finished what they're using already, then I'll say, right, you may as well start both of them. And most of those patients can tolerate the retinol that's in Emepelle. It is a mild retinol. It's not, you know, there's 2 steps. The skin has to convert the retinol, the 0.1% retinol in Emepelle, to the retinoic acid, which is the active form. So it's quite mild, so most people can tolerate it.
I'm really curious to understand how you do your consultations, and especially for skin, because at least in my experience, most patients don't have a good understanding of their skin. Even if it's terrible, they tell me it's fine and they're happy with it. Whereas, you know, we're in Australia, we see a lot of sun-damaged people, Caucasians living in a climate that probably isn't suitable for them. So how do you explain to patients about their skin care and sort of skin quality? Do you have any technology in your clinic to quantify it? I'm just curious to understand how you do it, because I know you've been doing this for longer than most people.
We do have the technology. We have the camera that shows their vasculature underneath, you know, if they've got any sort of redness, which always shocks them, and the pigment filter as well. So that we do use that in our consultations. But I say to because I agree with you, a lot of patients are just, oh no, just give me my toxin and this. But I say to them, look, if you had a Rolls Royce that was filthy, dirty, it's still going to look worse than a 20-year-old Toyota that's, you know, shiny and looked after. That's the one you're going to look at and say, wow, that looks great. And patients tend to sort of get that. I say, I can give you all of the injectables that you want to give you the Rolls Royce underneath, but if it doesn't look great on the outside, you're wasting your money. So I generally just put it back on them and say, look at your skin. Could it be better? Is there some redness there? Is there some pigment there? Are you reacting? By the time patients are mid-40s to 50, they're seeing it themselves. Even if you know, they haven't agreed with you in a year or 2 prior to that, they start to see it. The other thing I do as well, I actually send them. There's a great skin pyramid article from years and years ago which explains all of the products that we can use and how they penetrate the skin. It's a very scientific article, but a lot of my patients want to learn. You know, they're at the point they've been doing injectables for so long, they actually are thirsty for knowledge. And I think with podcasts and things these days, everybody's listening, everybody wants to learn. And so I actually give them this article and I say, look, read it for yourself. And then they come back and they say, I understand now. Right, now what can we use? So I guess it's all about educating the patient. And I find that with menopause overall, a well-informed woman is going to make good decisions. And so that whether that be HRT, non-HRT, but they are definitely open to using products on their skin that are going to be helpful once they understand what to do.
Yeah, part of the challenge, I think, is we've kind of programmed ourselves and our patients to expect instant gratification. So, you put your toxin, it's working within a few days, fillers instant. And so we're talking now about things like regenerative health and peptides and things like this skincare product. And I think it's just almost like a paradigm shift to explain to people this is a journey. It's not going to happen automatically. How do you deal with it, Jake? I mean, it's an issue. Would you agree, this instant gratification?
Look, skin is confusing and I'm certainly still learning because it's not my specialty. I explain to my patients because very occasionally they book in for a laser treatment and they come to me and I'm like, I'm not the laser guy. So, we have to sort of move them downstairs and give them to the laser team. But I think that people are confused about skin. They don't understand it. They're heavily marketed to. There's a lot of stuff out there that's garbage and they've tried it all or they've tried bits of it. You go into their bathroom cupboard and it's just full of stuff that they probably don't use anymore, but they've bought over the years. And I still think there's this perception of the magic cream, the elixir of youth that's going to change their life. And I don't know where that comes from. It must be good marketing from someone, but it doesn't exist. And so I explain to my patients, I think you used the term before, it's like going to the gym. It's a consistency thing. It's very boring. You've got to do it every day. But in about 2 or 3 months, you're going to start seeing results and that will spur you on. But you've got to commit to it for 3 or 4 months. Otherwise, it's not really worth it. Yeah.
That's actually how I explain it to my patients. It's about going to the gym. That's the analogy that I use. Like with radiofrequency microneedling, often they don't see enough, of that wow factor after the first treatment. And I say, well, it's like you saying, well, I'm going to go to the gym for, 1 week. Wow, I'm done and dusted. I say you wouldn't do that. You shouldn't do that. You should commit to, a long-term training program. It's the same with the skin. So yeah, I absolutely use that gym analogy. I think we're also injectors in general have this amazing opportunity at the moment because we see these women who are 30, 40, and then, aging with us. We're in the perfect situation, and it's actually almost our responsibility to start identifying that menopause is having a factor and playing a big role in this, because it's not just skin, it's the fat pad changes, it's the bony changes that we're, the effect of estrogen on the bone. It's making changes in the patient's face that, yes, we're filling up or we're trying to get rid of their lines, but in reality, we should be identifying that it's menopause related, as well as chronological age and extrinsic factors. But I think we are in this prime position to actually speak to patients about it, and I think we should be speaking to them about it.
Do you work with anyone who specialises in hormone replacement? Do you have a go-to referrer? Because, again, I have this conversation a lot and I sort of have to hold my hands up and say, probably the best bet's your GP, but I have no idea whether their GP is going to help them or kind of ignore them. So, I mean, moving forwards, do you think that we'll start working as aesthetic practitioners with a little team that we all sort of internally refer to? Do you think that's the best pathway, or... where are we going?
Well, that's actually not a bad idea, because what I'm finding with most of my patients is that, and like absolutely consistently, I say to them, maybe go and talk to your GP about it. Oh, I don't, my GP, I haven't got time. My patient, my GP won't see me for that. They're not interested in HRT. They really seem like they don't understand menopause. Honestly, it's a consistent response from patients. So they say to me, do you have anyone that I can see? And unfortunately, I don't have anyone that I can refer to, but I've actually just brought on a GP to my clinic. She is an injector, but she has a special interest in menopause, and I did it for that reason, because she's quite happy to manage, the menopause in relation to the aesthetic space, as well as their overall health. They will certainly be referring them back to their GP for, things like pap smears and, breast exams and things like that. But there is a major problem with access to GPs who actually want to specialise in menopause. And so I agree with you, it's really hard. But yeah, hopefully my GP coming on board will say, solve that problem for our clinic.
That's brilliant.
Well, I think we're starting to see, the rise of the integrative GP, the GP that's looking at health proactively, looking at the blood markers in a much more detailed way. They're looking at proactive health rather than reactionary health. So I think we are moving in that direction slowly. It's starting to become more popular. We did an episode some months ago with Dr. Izzy Siller she's from Victoria as well. Young doctor who's really switched on with his stuff, that's looking at things in sort of a different way and educating themselves on how to look at things from a perspective of let's look after you before you get sick. Let's look at your blood. It's not just enough to be within a healthy range. How do we optimize your health? What things can we do with your lifestyle, your sleep, your stress levels? All these sorts of things have a compounding effect on our minds and our bodies. So I think we are moving in that direction. It's just slow, like change is slow, but sometimes it's slow, and then it's all of a sudden, and then it's here. I was going to ask, are there any is any utility for patients who aren't in that category of menopause or perimenopause? Is there benefits to people using this in their skin? Is this something that men could use as well, or is this just only for women with menopause?
No, look, absolutely everybody can use it because, as I mentioned before, it has got all of the things that I would normally prescribe anyway.
Mm-hmm.
Got the retinol in the evening. It's got your vitamin C in the morning and ferulic acid. It's got your hyaluronic acid and your peptides. So absolutely men will benefit from it as well, and as well as younger females because it is a all-in-one product. And that's what I find that patients really like, is that they have their serum. It's basically got everything. They're not walking around with 3, 4, 5 different bottles of a C and a this and a that. And then at night time, it's got their retinol in it, particularly for a younger patient who may not want a really strong retinoic acid. They're definitely going to benefit from all of those. But I would then also push the point with, if I'm talking about skin with a younger patient or with any patients, that they have to really work on their sun protection.
Yeah.
Be wearing a broad spectrum SPF every single day and reapplying.
Mm-hmm.
What are your thoughts on David's favourite topic, collagen banking?
Mm-hmm.
And, especially talking to your females in their late 30s and early 40s who haven't gone through early menopause symptoms yet. How do you explain to those women that, if you optimise now, even if you have a rough journey through menopause, you're going to sort of put in the building blocks to sort of get through it better and look better, obviously, as well?
Yeah, we definitely discuss collagen banking with them. We show them the graph that shows the collagen loss over the years, and they're generally very shocked when they see that, because it's this sort of decline gradually, from birth rate really, but from 20s onwards, you're getting that decline, and then that sudden drop off in that sort of 40s, 50s year age group. A lot of the 30-year-olds these days are very educated and they are very keen to do collagen banking.
Yeah.
We have a lot of sort of women in their 30s wanting to do Profilo because, which is the hyaluronic acid injectable for collagen building. That they're definitely keen to get onto that, even if it is a couple of times a year. They know that that's going to give them benefits long term, and they like the hydration. And the same with cosmeceuticals. They are sometimes more educated, than the practitioner, and they are keen to get on board with a lot of that collagen production in their 30s, certainly into the 40s.
Right.
Talking about educated patients, I have come across a phenomenon, I think it was on TikTok, where people are using their vaginal cream for their face. Now, I understand the logic to that, but what are your thoughts on things like that?
Definitely, that is something that I discuss with my patients all the time, because a lot of them are already either on HRT or HRT and their vaginal estrogen. Estrogen in face products has actually been used since the 1920s. It was in the 1920s in London, and then Elena Rubinstein actually took it back to the US in the 30s, and it was a very, very powerful product, and a lot of patients benefited from having estradiol into their skin products. And so that was actually taken off the market. I think the FDA banned it from around 1998. It was actually quite late. So there is absolutely a lot of evidence that estrogen on the face works, which is why it's nice to have a non-hormonal option for that. But if someone's already using a vaginal cream, we know from many studies that the absorption systemically is pretty much non-existent from using vaginal estrogens. And so I say to my patients, okay, well, if you're going to be using the same, just very small amount, particularly in the key areas that people are complaining about, under the eyes, the neck, back of the hands, then really they should be seeing the effects of, estrogen causing benefits on the receptors, and they get the hydration, they get the collagen building in those areas. And personally, yes, I've seen it on patients improve, particularly the under eye area. They sometimes need a bit of convincing to use their vaginal cream on the face, but it's either that or we can compound estriol, but generally I just say, look, go and get the over-the-counter vaginal creams, and you can use that. Again, some people are still reluctant to have hormonal estrogen, and so then I discuss with them that there is this alternative, Emepelle.
Excellent. So are there things that sort of impact or increase the effectiveness of the product? So hydration, lifestyle factors, or is the product going to do what it's going to do irrespective of that? Or they're the things that they can be doing to sort of amplify the effects?
I don't think that they can be doing anything to necessarily amplify, but certainly hydration plays a big factor. Your skin's going to be looking a lot better if you've got increased hyaluronic acid in your skin and you are hydrated. It's going to look better than if you are not hydrated. Sleep is a big one. You know yourself, if you've had a good night's sleep, you tend to look better. And I often have patients come to me asking for tear trough filler. And I say to them, look, you can spend your money with me putting filler, or you can go and have a good night's sleep and you'll probably wake up and look, sort of 50% better anyway and save your money. So it definitely has a big factor. The problem is with menopausal women, they're not sleeping well anyway. And so that, that can compound things. Exercise, obviously, keeping fit, keeping a healthy body is going to reflect in the face. And making sure, it does depend. By the time you get to menopause, a lot of sun damage has already been done. 50% of your lifetime exposure to sun happens by the age of 18. So by the time you get to menopause, some people are approaching it with a great amount of collagen already in their skin. Others have really hammered it in their younger years, and they're approaching menopause at a lesser sort of rate, a lesser stage. And so the Emepelle itself is going to treat both of those women who are coming into at different stages, but I don't think there's nothing topically that they can use that's going to make the Emepelle work better or worse.
What do you think about collagen supplementation? It's another topic that we've done on a podcast before, but what are your thoughts on collagen supplements?
We get asked that all the time. My understanding is that there is no real evidence to show that the collagen that is being ingested orally is going to have an impact on the skin. That's my understanding. I haven't seen any real data to date that shows that that's the case.
We'll have to share it with you.
Yeah, we'll share it with you.
Really?
We did a whole podcast on it.
I do say this anecdotally to my patients. Absolutely, they come in and they say, my skin's looking better, my hair's looking better, my nails are better. But no, absolutely, I'd be happy to read that.
Yeah. Sure. So I'm correct in assuming that having Emepelle in your clinic, that it's kind of potentially allowed you to simplify what you sell within your practice? Does this sit alongside many other skincare ranges that you have, or is this kind of taken front and center in terms of what you offer to your patients?
It's taken front and center what we offer in terms of the peri and postmenopausal women. We certainly discuss it with them because of the benefits of this MEP technology. We do stock a couple of other ranges. Actually, a lot of our products come from George because they are very effective products, and they are, a lot of them contain numerous factors in one component, one bottle. So we can say, okay, well, you can use that as your morning product, or you can use that as your nighttime product. And they also have a very nice retinol range. So we do stock other products. And we discuss that with the patient. But if someone is approaching menopause, I say, well, okay, you can use those products, but then there's this one which has all of that in it anyway, but you get the benefit of this MEP technology, which is going to help you with your estrogen deficiency issues in the skin.
What does it look like, feel like, smell like? How many pumps do you get out of each vial or cream? How long does it last for?
So the night cream is in a jar, and so you obviously you just put a little bit on. I tell my patients, particularly when they haven't used a retinol before, just to dot it all over the face and then rub it in. The day serum, which you can use at nighttime as well, but it doesn't have the retinol. It is a pump, and just say one pump for the face. I generally do say if you're going to do neck and deck as well, you probably need a second pump, but it's really nice on the skin. It soaks in nicely. I do tend to say, look, maybe use a moisturiser, just any moisturiser over the top in the day, but the nighttime, no, they don't need it. And then obviously they're using an SPF over the top in the morning. But the product is really well liked by patients because it's not thick, it's not gluggy, it's just very lightweight on the skin.
What about arms, legs, elbows, knees, all those areas that, presumably women complain of?
If George would give me enough to put all over my body, I would absolutely use it. 100%, I see it on patients all the time. They're always asking me about particularly their upper arm, what can I do about the laxity of the upper arm? And I do send them off, I must say, to a business near me that does radio frequency on the arms, and they book them in for 10 sessions and they get a moderate improvement. But yes, if we had bucket loads of Emepelle, I'd love to I'd use it personally, and I would love to sell it to patients for their body.
Right.
We'll need to do a clinical trial on that, I think. So.
Yeah. Disclaimer, this is off-label. We can also do bioremodeling on unusual body parts as well.
We did.
Yeah.
Okay. We did a podcast on that just recently.
We did, yes.
All right, George, I'm Jewish, you're Greek. Let's talk about the money. Talk to us about, what's this product going to cost? What are the margins on it? Because I'm sure practitioners that are thinking about stocking this in their clinic want to know this stuff. We sort of got to get to the money at some point. So tell us all about it.
Of course. I think one of the exciting things about this is that everyone, any clinic, either small or large, can afford to have a small and concise skincare range, even if it's a nurse working from home or a busy clinic. So I think that's the first important point. And the second one is, as we've discussed today, it's very relevant to a very big proportion of patients that everyone sees. We were talking about the products, what's the cost to the patient. The two main products that Simone was highlighting today, which was the serum and the night cream, I can tell you that two of those products used every day will set the patient back $6.50 per day. So it's a little bit over a cappuccino at a decent cafe.
Yeah.
Over the last 13 years, we've been building a great portfolio of skin. That's what we're very proud of. We have a number of different brands depending on the price point, where your clinic is and affordability, I guess. But one of the things that we do love about our brands is that they're all scientifically backed. We have ingredient technologies that Simone was alluding to that are not found in typical skincare ranges, like growth factors, stem cell activators, DNA repair enzymes, MEP technology. So what we pride ourselves in is the advanced technologies, the advanced skincare, and we promote our products to healthcare professionals. So we feel that because of the high level of technologies in our products, we need to go to the people that actually understand and appreciate these technologies, like Simone has with many of our brands. Some of the brands that we have are Dermocosmetica from France. We have Biopel, of course. We have Isdin from Spain, Cantabria from Spain, the two leading dermatology companies in Spain, and Eniomi as well. So, and of course, our partners at IPSA making our bioremodeling product also have now got some beautiful skincare, in particularly in the makeup area as well.
Excellent.
Well, Simone, thank you very much for your insights. I really enjoyed that. It's good to learn something. If you are listening to this and you are suffering with symptoms, we'll also put some other links just with some references to World Menopause Day and some maybe some local resources if we can find them.
Yep, absolutely.
Fantastic.
And thank you to George and Dermocosmetica for supporting the podcast and trusting us to get your message out there. So thank you again. It's lovely to work with you, and all the best. I'm sure this will be successful, and looking forward to catching up soon.
Thanks, guys.
Thank you very much.
Thank you.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.